Good afternoon, and welcome to the Your Health radio and television program on the radio at AM 1240 KNRY, AMP Cable Television Channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Good afternoon. I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and this is Your Health radio and television program. Thank you so much for joining us. My very distinguished first guest today, Dr. David Flemming, urologist. Dr. Flemming, thanks very much for being here. Appreciate you coming.
Thank you, David. Thanks for having me.
Dr. Flemming, before we get on to our main topic, which will be kidney stones, I'm sure a lot of our audience wants to learn about kidney stones. Let's back up for a moment and talk about your specialty. That's urology. Tell us what a urologist does. For example, what's your average week like?
Well, a urologist is a surgeon, and a lot of people don't really know that. So we we cover everything with the urinary tract, the kidneys, ureters, bladder, prostate, those type of things. So I see men, women, children, anything that can happen within the urinary tract or the reproductive system in males, and all of the urinary tract in females.
So give us some examples of why a man might see a urologist or why a woman might see a urologist. And in fact, when you said you even see children, what type of urologic problems do children have sometimes? Maybe we can start with kids.
Well, as far as congenital defects go, the urinary tract is near the top of the list. So in my earlier years at the university, I actually did special training in pediatric urology because there are so many abnormalities in kids, and so there are tumors that develop in kids. There are errors in development, bladder development, renal development, infections, what's called reflux, urine backing up into the kidneys, abnormalities in development of the male penis. So many different types of things.
Dr. Flemming, I recall, of course, from my plastic surgery training, I did a microsurgery fellowship at Children's Hospital in Los Angeles. We frequently would work with the urologist for children with congenital differences and things like that. It's very rewarding work.
Right. There.
So before we go on to what problems you might see for men and women, tell me about your training. You mentioned you did a fellowship in pediatric urology.
After medical school, so we all go to medical school for 4 years. Beyond that, there's a 2-year training period in general surgery, which encompasses multiple different facets. I spent time doing actual general surgery, some plastic surgery, neurosurgery, cardiac surgery, orthopedic surgery, a little bit of everything for 2 years. And then another 4 years beyond that, specializing in urology. Now, the chairman of the program where I was a pediatric urologist, so I spent my 4th year working with him, basically doing mostly children.
So you did a whole 2 years of general surgery or rotating through surgery services. You learned a lot about operating and how to take care of sick patients, and you learned about different specialties, and you trained in them. And then you did a whole 4 years of urology after that.
That's correct.
It's a long road.
It takes a while.
and from what program did you graduate, Dr. Flemming?
I was in New Mexico at the University of New Mexico.
Is that in Albuquerque?
Right. And that's the regional referral center, basically for all of New Mexico, southern Colorado, West Texas, part of Arizona, and so it was quite a large drawing area.
I see. And how long have you been on the Central Coast?
16 years.
Time flies when you're keeping time. And you're here in Monterey, Dr. Flemming, is that right?
Right. I have several offices. My main office is in Monterey.
Okay. So let's get back to what a typical week for you might be. Like, why do men come to see a urologist?
Well, I'm in the office typically about 3 days a week. Like I say, I have 2 other offices where I spend time as well. I'm in surgery some part of 3 or 4 days a week. And in fact, today I spent a good portion of the day taking care of kidney stones. So People typically come in, male and female both, for urinary tract infections, pain, blood in the urine, or an abnormality in blood tests, or an ultrasound, or a CAT scan that may have been ordered by their primary care physician. And they would then be referred to me for further evaluation of those abnormalities.
And you see both men and women.
Correct.
So as we said, the urologist takes care of the paired kidneys, and there are two, and then the ureters, and the bladder, prostate, etc. And
all the external male genitalia.
All the external organs as well.
Right.
Okay, so Dr. Flemming, let's talk a little bit about the kidneys before we get into the kidney stone and kidney stone formation and how we treat them and how they occur. I think most people don't really understand what the kidney does. You know, I think we all learn in grade school that the kidney sort of serves as a filter for the blood and makes the urine. But I understand the kidney does lots of different things. Isn't that true?
There are certain hormones that are produced by the kidney as well. It's really, it's a fascinating organ, or two organs. People will oftentimes ask you, well, why would you go into a specialty like this where you just spend your day looking at urine samples, which is far from what I do. But the kidney has an amazing resilience. And we talked a little bit earlier about the pairing of the kidneys, and so there are about 4 million nephrons in the kidney, and so the nephron is a functional unit of the kidney. There are 2 million in each kidney. You need somewhere between 30 and 90,000 nephrons in one kidney to remain off of dialysis. So the backup system is pretty amazing. People are oftentimes concerned that if there's an injury to a kidney or a tumor in the kidney has to be removed, you still have 2 million nephrons left over in the solitary kidney. So many people are born with a solitary kidney. You can certainly live a completely normal life with just one.
But Dr. Flemming, that brings up a point or a question that I had in my mind thinking about you coming on the program. We have one liver, we have one stomach, we have one pancreas, but we have paired kidneys. We have 2 kidneys. Are there any good theories why we have 2 kidneys?
I don't know the exact answer to that. Certainly, developmentally, the kidneys and in the male, the testicles tend to develop in a very similar location in the center part of the torso, and as the fetus grows, the kidneys will then ascend up to the upper part of the abdominal cavity, and the testicles move down. So they go in different directions, but have a very similar blood supply. So issues that we have to deal with that are ongoing surgical issues always come back to the abnormalities, potential abnormalities in the blood supply as the kidneys move upwards and the testicles move down. So I don't know the exact answer.
Certainly nice to have a spare, don't you think? Because the kidney is so essential.
Well, and it's, obviously there are people that have donated a kidney to a family member or whatever, and so there again, with the risk of surgery being significantly decreased in this era, as you know, that's quite a safe procedure, and certainly the donor has no real downside.
So Dr. Flemming, we can say that it is the job of the kidney, as you said, it's the nephron that filters the blood and makes the urine. Now, what other things does the kidney do? I think the kidney helps control your blood pressure, right? And
right.
Might control somewhat your red cell level and your osmolality, right? So it's an amazing organ, really. It does more than make urine. It's
really fun to talk about. I mean, do we have 2 hours here to...
I'll have to bring you on the program again.
There's an auto-regulatory mechanism. There's several actually in the kidney, and that's certainly where there's regulation in blood pressure, what's called a renin-angiotensin system. That's very accurate and important. There's a hormone called erythropoietin that you alluded to. That's very important in the development of or maintenance of the red cell volume in your body, and so the kidney is critical for that.
Okay, so Dr. Flemming, as promised, we want to teach our listening and viewing audience about this big topic. I know we could talk for hours about it, but we want to teach them the basics about kidney stones. So maybe you could start out by telling us exactly what is a kidney stone?
It's certainly been studied for years and years. One of the original interventional techniques was Hippocrates, obviously, and that was with bladder stones. So stones have been around since record keeping has been available. But there are multiple different theories as to why kidney stones form. But for the most part, it's a super saturation of the minerals in the urine. And there's some what are called inborn defects of metabolism that increase that. But it basically comes down to the mineral content in the urine as compared to the fluid content or the saturation of the minerals within the urine.
So Dr. Flemming, you mentioned bladder stones as well. So stones can form in the kidney and they can form in the bladder, or is it the stones come down from the kidney into the bladder? How's that work?
All those things can happen. The bladder stones are not a real common thing in the United States. They're much more common in third world countries. They tend to come about in males and females both due to incomplete emptying of the bladder, some sort of obstructive mechanism. So in men, it's the prostate. In women, there can be other issues. There can be some damage to the urethra after a particularly difficult birth, for instance, with some narrowing of the channel. Incomplete emptying infection will lead to stones. Kidney stones are different. So a bladder stone most of the time is composed of uric acid. Kidney stones, there are multiple. There are 8 or 10 different types of kidney stones.
There's 8 or 10 different types of kidney stones.
Right.
Now, are they all related to, or are any of them related to, say, if someone doesn't hydrate enough or drink enough water during the day, or are they different causes for kidney stones?
Well, as far as we know, hydration is really the key. And it's interesting if you look at a geographical variation in the incidence of stones. There again, I'm just talking about the United States. So as you move from west to east and north to south, the incidence of kidney stone disease increases. So the southeast has far and away the highest incidence of kidney stones in the country. And we think what happens is that with a hotter climate and a humid climate, and in particular during the summer, where people are out more and they're doing more things and they're not staying adequately hydrated, then once again that supersaturation of the minerals in the urine progresses at a more rapid pace and the stones develop. Now, not to interrupt you, but interestingly here there's a pretty significant incidence of stone disease as compared to the general population or the population density. And so that's, I think, and there's some evidence to show that it's a unique area where you can be outside pretty much year-round. People are active, they're doing things, but it's never very hot. And so your thirst mechanism doesn't kick in as it would or in some place, Fresno, for instance, where it's 100 degrees. And so people tend to be relatively dehydrated, and that increases the incidence of stones.
So, Dr. Flemming, is it fair to say that one way to prevent kidney stones is to make sure that you are drinking enough water? Is that a fair statement?
Absolutely. That's what we tell everybody that comes in.
But isn't it true that for some people, and there are some types of stones that will form even though you do hydrate well, is that true, or is that a misconception?
That is true, and there's a whole procedure that we go through as we see people. So not uncommonly, your first experience is through the emergency room in pain. You're not sure exactly what's going on, maybe some blood in the urine, those type of things, and we work through that, and the stone passes or is treated. And we like for patients to collect the stone particle if possible, so we can analyze it, see what type of stone it is. And beyond that, oftentimes we'll proceed to what's called a 24-hour urine collection, where we can see the total volume of urine output over a 24-hour period and the mineral content. And we can work from there, depending on what type of stone it is and which minerals are out of whack, to potentially adjust the diet or fluid intake to help prevent a recurrence.
Okay, so we talked about fluid intake and drinking enough water. I recall in chemistry class, and this may be a good analogy, I'm not sure, our professor was teaching us, let's say we take a beaker full of water or half filled with water. We can add some salt and it'll dissolve. We add some salt, it'll dissolve. But eventually, if you keep adding salt, it'll just go to the bottom of the cup, right? Bottom of the beaker or the glass, and it won't dissolve within the water. Isn't that true?
That's exactly right.
Is that one way that you can think of a kidney stone forming in the kidney? Is that the way that works?
Mm-hmm.
So at a certain point, there's a mismatch between the amount of salt, is it circulating in the serum, and hydration, or is it salt that's precipitating out?
It gets a little bit complicated with all the different minerals, but roughly 75 to 80% of stones that we see are called calcium oxalate. Okay, so there's a calcium level in the urine and what's called oxalate, which is a common component in red meat, in green leafy vegetables, chocolate, nuts, soda, coffee, all those things that people like. And so traditionally over the years we've advised people to restrict their calcium intake. Well, more recent studies show that actually may make it worse. Because there's an imbalance with what are called the cations and anions, charged particles, as they
Right.
move across the barrier in the kidney and in the ureter, and you have to be careful with that balance.
I see.
So actually, we're starting to recommend that people either maintain and in some cases increase their calcium intake, because it influences the movement of sodium. So when you think about, you asked about salt. So salt is sodium plus chloride. And the movement of sodium across the barrier seems to be more important than calcium.
That's amazing.
So we're actually asking people to restrict their salt intake, not calcium intake.
I see. Dr. Flemming, we have about a minute left, so I want to make sure that we give out if you have a website or a phone number, and then I want to ask you a little bit if you can summarize what lithotripsy is.
Sure.
Okay, so do you have a phone number or a website?
Yeah, the local phone number is 373-4304. Our website is under construction,
Under
I guess they
construction.
say.
So Dr. David Flemming, you're on Pacific Street?
Correct.
Right here in Monterey.
Right.
Now, we only have a few seconds. Now, what's lithotripsy?
So when people come in and they have a stone that's not going to pass, we have a special machine that we can utilize that you focus with what's called fluoroscopy with an X-ray beam and identify the stone. And then we tell the computer what to do. It sends shock waves externally into your body. It doesn't focus at the skin level. It's what's called F2, the focal point inside of the body, right on the stone. It introduces energy in there. It typically takes 2,000 to 3,000 shocks to get the energy in there enough to break the stone.
Amazing, and it's a huge...
It's an incredible breakthrough. I worked with one of the original machines in 1984 in Iowa, and the technology has been huge. We hardly ever operate on people anymore for kidney stones.
Well, Dr. David Flemming, urologist, expert in kidney stones, I certainly appreciate you coming on the program, and we've run out of time, but I hope you come back again.
Thanks, David.
Thanks very much for being here.
Appreciate it.
I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health radio and television program. We're going to come right back after a very brief pause for a very good cause. Thanks for being here.